Excuse me, sir. Are you a doctor?
Why, yes. Yes, I am. Actually, I am team physician of the Miami Dolphins.
Wow. I am actually taking sports medicine right now. I am on my way to take a test on the head, face, and throat. I actually didn't study very much. Hey, do you think you can help me study for my test?
Well, I suppose so. It will actually help pass the time. What would you like to know?
Please, tell me about a cerebral contusion.
Ah, yes. The cerebral contusion is one of my favorite injuries. A cerebral contusion is an injury to the brain that involves small hemorrhages. They occur within either the cortex, the brainstem, or the cerebellum. Cerebral contusions usually occur when an athlete's head strikes a stationary object such as a pole. An athlete will usually become unconscious and then subsequently become very alert and very talkative. Other signs will include headaches, dizziness, and nausea.
What kind of care should an athlete with a cerebral contusion receive?
Hospitalization is the standard practice. The injured athlete should receive imaging tests. An athlete will be allowed to play when he is asymptomatic and a CT scan is normal. At least, that's what we do for the Miami Dolphins.
Wow. This is so helpful. You should be a teacher. Hey, what is an epidural hematoma?
Well, there are blood vessels embedded in the interior of the skull. A blow to the head can cause these to tear. The result is an accumulation of blood causing an epidural hematoma. Because of the blood pressure, these can form very fast. Like the cerebral contusion, the athlete will usually lose and then regain consciousness. The athlete will appear to be fine and have few or none of the symptoms.
How do you know when someone has an epidural hematoma?
Well, gradually symptoms begin to develop and worsen. Severe head pains, dizziness, nausea, sleepiness, or dilation of one pupil on the side of the injury will occur.
How serious is an epidural hematoma?
Very serious. In fact, it can be life-threatening. The only way to diagnose an epidural hematoma is with a CT scan. The athlete should be scanned for one as soon as possible to avoid possible death.
It's a good thing that they are not as common as the subdural hematoma.
Yes. Do you remember from your studies what a subdural hematoma is?
Oh yeah. A subdural hematoma results from acceleration and deceleration forces that tear blood vessels that bridge the dura mater and the brain. If I remember correctly, the signs and symptoms are similar to the epidural hematoma. That's all I know about that. What are other differences between the two?
The subdural hematoma usually involves venous bleeding. Therefore the signs appear more slowly. However, it is still a life-threatening condition and medical attention should be given right away. Basically, any treatment to head trauma injuries should include a computed tomography scan.
I guess it's better to be safe than sorry. So, please tell me about migraine headaches.
A migraine is a severe headache with a sudden onset that recurs frequently. The exact cause is unknown, but it is believed to be a vascular disorder.
Ah yes. You know, I've actually had a migraine before. I experienced flashes of light, I had partial blindness, and I had a tingling sensation.
Did your parents have migraines? There is evidence that migraines may be hereditary.
My father used to get migraines. So what do you do when a Miami Dolphin has a migraine?
Unfortunately, there isn't much I can do. The best course of action is prevention. Prescription medications are available to help reduce the recurrence of migraines.
Well, it looks like my step is coming up. One more thing. I've never understood what is so bad about scalp injuries.
Good question. The scalp has a lot of blood vessels and is prone to bleeding. The exact location of the injury is difficult to pinpoint because of all the blood and hair. You should always suspect a more serious injury with scalp injuries. Control the bleeding. I would generally suggest referring out to a physician.
Thank you so much. I think I will get an A on my test.